everyone, myself is Sadakat and I have been associated with MyAussieTutor since the past 1.5 years in academic writing. And today's topic that I'm going to discuss is family-centered care. I have a bachelor's in history and a master's in public health. Basically, what are we going to discuss today? We're going to discuss the definition of family, what is the role of the family, what are the members of family that are included, and what is family-centered care and what is it considered. Basically, what is a family? When we look at the definition of a family is a cohesive social structure. Family is a cohesive social structure which could consist of basically individuals or a group of people who are related to each other. So basically, it's basically a group of people who are either united by the ties of marriage, either by blood or adoption, and they constitute a single household and interact with each other in their daily life. Basically, it's a group of two or more people that are correlated together by birth, marriage, adoption, or any such related members are considered as members of one family. Now, this family could either include a son and a daughter, a husband and a wife and their children. It could include the Simpsons family. It could also include a father and a son alone. It could include a mother and her daughters alone. It could include two men who have adopted a child together. It could include two women who have adopted a child together. So that is a comprehensive definition of a family where there is two or more individuals living together, either related by birth, marriage, or adoption. And all such related people are considered as members of one family. Several interpretations have been developed for family. Our interpretation often depends on our own experience of a family. Ultimately, the family is defined by itself. In today's world, we must be open to the type of families that we can meet. As we discussed previously, there could be multitudes of types of families that can exist. It could be a husband and a wife with their children. It could be just a husband with his children, a single dad with his children, a single mother with her children. It could be just two sisters with their two elder sisters with their siblings, living with their siblings. It could be two women having adopted a child together. It could be two men having adopted children together or having had children together. It could be parents who have adopted children who do not have real children. It could be a mix of adopted children and their own children and parents themselves. It could have parents, grandparents, and family. So families could include a huge number of things. Ultimately, the family is eventually defined by itself. There could be many and every type of families that can exist in the world. Therefore, as nursing individuals and as healthcare practitioners, we need to establish who is in the child's family. When you're looking at pediatric practice or family practice, you are focusing at the children and the child's work. Then you should know that what is it that the child considers his or her own family. The child in the hospital, when the child is admitted to the hospital or comes to the hospital can be a new and a frightening experience for the children. Often their families are the only familiar aspect that they're used to. The hospital should not diminish the family's role in children's care, and family-centered care recognizes basically nursing care is most effective if it is done in conjunction with the parents of the children. So family-centered care, when we look at it, basically it recognizes that nursing care is most important effective if it is done in conjunction with the parent. It is made up of a set of values, attitudes, and approaches so that you are able to service children and children with special needs as well and their families. It could include care burden that is dependent on the family resilience, the sibling needs that should be looked at, the parenting styles that should be looked at, the quality of life that they are living that should be looked at, social support, information seeking method, parental stress, cultural, spiritual care that they are taking care of, and decision making. So all of these things should be looked at and appropriately worked upon when you are looking at family-centered care that is being provided to the children in the hospital. So family-centered basically broadly defining as a partnership that develops between the parents of the children and the healthcare professionals while you're taking care of the child. And it could have many aspects where you are looking at quality improvement, patient safety for the children, and also looking at parental involvement. Basically, mothers are preferred as carers, allaying children fear. It's about the nurse and the family-patient relationship. Basically, family-centered care and communication that is informing and explaining the family, the parents of the child, what is happening, what is about to happen, what you are doing, how you are going to take care of the child, instructing them also and educating them also, developing their health beliefs and developing their health this thing, and setting boundaries if the parents are uncooperative. Then you have to make sure you find a way around how to make them cooperative and how to set boundaries where the healthcare professional has to eventually work and intervene for the benefit of the child, where the parents cooperation has to go away. And then there are unwritten rules sending the parents away. That is a negative aspect, we're sending the parents away, absolutely. So setting these boundaries is important, but looking at the positive aspects and the negative aspects of this is equally important. So when you are starting with your family-centered care, you have to first assess the family relationships with the child that the child has with his or her family. Are both the parents involved with the child or not? Or is the child completely dependent on either his mother or his father? So that should be what should be looked at appropriately. Then how many siblings in the family and how is the child involved with his or her sibling? Are their grandparents involved and how much involvement is that of the grandparents in the child's care, and how important is the grandparents' decision making regarding the child? Any other important people that are associated with the child, and will someone stay with the child in the hospital or not? Any other important people that are associated with the child, and is someone interested in staying with the child in the hospital or not? That is, if there is grandparental involvement in the child's care, or is someone willing to stay with the child in the hospital? And are there any other important people apart from the immediate family, or that is siblings, parents, and grandparents, who are involved in the child's care or who are important for the child as a part of the family, or who they consider family? Some relatives, some sisters, some parental sisters, aunts, nephews, nieces, anybody else who is also involved in the family, uncles and aunts, that are also considered important by the family and the family relationships that they have built. So all of that should be assessed by the nurse in managing and planning care for the child. For example, you can see the family structure. How is it written? That is, there has to be a parent's note. That is, who are the parents of the child, who are the siblings of the child, what is the age of the child. John plus Anne Smith is written. The parents' siblings are brother Kevin, age 2 years. Other important person, like I told you, is granny or nanny. Mary Smith is granny. Parent resident is Mary will stay in the room, that they stay in the this area. Consent has been given, yes. ID band, yes. This is immunization has been done, yes. So basically, this is the structure of the family that you need to note down in order to assess what are the other important people associated with the child apart from parents and siblings, and what is the parents resident, where are they living, and who are they staying with, how is the house like, what is the family structure. Are there other important people, for example, aunt, or for example, nanny of the child, is she involved too much? All of these things should be looked at. What is the role of the nurse when you are starting family-centered care, or when you are looking at a child and providing care to the child? Then basically the first role is to introduce yourself to the child and the parents as well, showing the child and the parent around the ward, telling them about the hospital facilities, asking the parents if they had slept well, had breakfast, explaining the care the child will receive that day or night, explaining what you're going to do for it. Basically, you need to ask the parents if they have slept well, had breakfast, if they are well taken care of. Explain the care the child will receive that day or night. So you basically have the role of explaining to the parents what you're going to do with the child, the type of care that we are going to provide to the child, what we are going to do with the child, what we are going to do as nurses in taking care of the child, whether there be blood pressure measurement, whether there be a dressing change, whether there be a medication that will be given, an observation that will be done overnight, whether they have to be kept in the ward, shifted to the ICU, or sent home, all of these things. Then asking parents what they would like to do, how they would like to be comforted, and then asking them, after explaining the entire procedure, for the consent, and asking them if they have any questions associated with the same. Parents basically have a right to make decisions about their child themselves. Therefore, they need to have all the information that is required about their child's condition, the treatment that is supposed to be given to them, and the nursing care that will be provided. So they can give their consent, and the consent can be informed consent, appropriate consent that they give. So do not be afraid to say, I do not know, when a child or parent asks a question as a nursing individual. In fact, you should say, I do not know, but I will get that information for you, so that you are able to present yourself as a responsible clinician or a healthcare practitioner or a nursing professional who is able to gather the required information that the parents require, so they are able to make appropriate decisions that need with all the information that they require. Negotiation. Helping parents to be involved in their children's care is an important part of family-centered care. There is a need to decide who will perform the care the child will need. That is the nurses and the parents together. Who is going to shower the child, change a wound dressing, or feed the child? And how does the nurse's routine suit the parents' routine? Does it match or not, or there is a change that is required? So family-centered care, remember, parents do not know that they can be involved in the child's care. You need to tell them that they could be, and this is what they can do. Nurses should not expect parents to be involved, but it should be explained by the nurses to the family, to the parents. They can be involved in providing care to their children. Therefore, negotiating with the parents what they can do and what they want to do is really important, so that they are as involved in their child's care as the nursing individual itself. A common myth is that family-centered care involves the parents staying with their child in the hospital. That is not true. It is basically support that is provided to the parents to be involved as much as possible in their child's care when the child is being taken care of, or when the child is getting treated in the hospital. Reasons may not might not stay because of the expense, because of their jobs, their personal reasons, if they have other children. Basically, it is not your job to judge the parents and their situation. It is basically to help them combat the situation as well as they can according to their circumstances, and help them take care of their child as much as they can as per their circumstances again, and provide them with all the assistance that is required in doing so. So the cost of staying with the child in the hospital will include food, rent, accommodation, transport. If they are taking off from their job, possible loss of earnings, telephone bills, child minders of other siblings, toys and treats, etc. What are the important points that should be looked at? That parents are not extra or unpaid nurses and should never be expected to replace nursing shortages. And they should not be expected to be involved in the children's care. Can they decide if they want to be or not? Again, as per the situation and circumstances that the family is facing at the moment. At that time, never assume that a parent will do something, and never judge parents because of your own personal opinions regarding their parenting styles that they are following, or regarding the choices that they are making in regards to their child, if it is not affecting or harming the child in any way. I hope you have understood the entire concept of family-centered care, and I hope to see you again in another topic another day. Thank you.